Welcome, friends, and thank you once again for tuning into the Optimal Health Program. I hope you're doing well today. Of course, we shall take your amazing questions and calls here. And the phone number, if you'd like to call, that's the antique way of communicating, is 888-420-9272. Otherwise, you can text or email Frankie.
Right in the comments.
Right in the comments here.
I'm there, baby.
We are on the most majestic rumble of rumbles, and proud to announce that within the next couple of weeks, we think our program is going to really take off. Rumble's doing a phenomenal job as a podcast platform. They've got a massive listening base, and during the week, the numbers are staggering for those who have an everyday program, which, as I spoke to Frankie about, would not be a bad idea somewhere in the future. But we love the fact that they appreciate us there. They set up a series of programs before ours. So starting next week, I think we're going to have a bunch of programs before us, and that can give us a great lead into our program. So we're pretty much doing 200,000+ views every Saturday without lead-ins. And also our good friends at Rumble will be promoting us on the weekday programs.
Shout out Jeremy.
Jeremy, yeah, he's our best buddy. And we want people to know during the week that they can, call and communicate directly and ask the doctor your questions. I mean, that might be the good way to promote it. Ask the doctor your questions. So this is, it's fun. And you just have to love it. Love interacting with people. That's why my voice half the time is strained, because I talk to patients all day, so many days a week. It used to be 6. Now it's 4, Tuesday, Wednesday, Thursday, Saturday. And a lot of good conversations with patients this morning in the office. A lot of good questions, just as we have great questions here. What do I do with this? What do I do with that? Why do I feel weaker? A lovely lady today was talking about, and she's always done a ton of exercise. This is a woman who's like a fitness woman. She's training with a friend of mine, Jordan. Big trainer, strong guy, great guy. And he's referred a lot of patients to me. And her vitamin levels were low. Her hormone levels were low. Sermorelin was low. That's the active component of growth hormone, IGF-1. Her testosterone was low, was undetectable. So she wasn't feeling good at all. And she's probably in her late 40s or 50s. But we need to walk her back to where she was 10 or 15 years ago, and then start to track her improvement with perfect vitamin levels based upon blood tests and the recommendations from that, perfect hormone levels based upon blood tests, recommendations, rechecking, and she'll kill it, because her mindset is already there, specific to doing lots and lots of exercise. And some days she runs, some days she rides a bike. She does Pilates, weight lifts 3 to 4 days a week. So she's she's on board with it. And it's great to see how people can evolve and change in doing that. Another lovely woman who her husband and she were talking about, and she came in, and she's had 3 kids in the last 5 years, which is a pretty, ambitious goal. That's a lot for your body in 5 years. So now, same thing. We went over her blood work today. We're going to walk her back, fix all of these things, and watch to see how well she can do. So it's all about making your body as healthy and as strong as you can now and carrying that through for the rest of your life. That's also why, and here's an interesting segue, why we talk about the Stay Strong program, where we're looking to monitor your vitals, of course, monitor your blood work, your vitamins, minerals, hormones, fine-tune things such as NAD, which is an important peptide, IGF-1 through Sermorelin, which is the active component of growth hormone, and make your body a healthier, better, stronger place. Get the best foods on board, best vitamins on board, monitor and track your vitals, your blood pressure, your weight, your heart rate, your sleep patterns. We'll be talking within the next week about some of the devices that are new coming up that we'll be utilizing, a band that you'd wear around your wrist, kind of a cool black rubbery band with a device in it that reads all of these parameters, your pulse, your oxygen, your temperature, a variety of different things that all gets sent to our computer So in your part of our computer where your chart exists, no more charts now, it's all electronic medical record, we can track and look at everything and keep you super, super healthy and strong. So staystronghealth.com, you certainly can go to our landing page there and see what it's all about. We're going to be doing it and starting it primarily with Medicare. Medicare is supporting that. So those who have Medicare 65 and older, the red, white, and blue Medicare card, we've created this program specifically for you. You could live far away from the office and not really come to the office, where we do telehealth visits, get your blood work done, send you a prescription, go over that with you, telehealth, put together recommendations for vitamins, minerals, hormones, exercise, diet, a wide range of these things, and then track your blood pressure, your pulse, your sugar, your heart rate, your oxygen, your breathing capacity if you have lung-related issues. So there's a lot of wonderful things on board with this. And as I say, Medicare covers this in part, and I think mostly because they want to save a lot of money. Because the people who end up having issues when they go to the hospital or go to the ER because they haven't been corrected quickly, they end up spending a great deal of money. Medicare does for that big ER visit. So if we can track and correct your pressure and correct your sugar and correct arrhythmias and do what we can to prevent the big hospital admission, that makes sense. Preventive medicine is the way to go. So this is part of a big project. For those people who are not on Medicare, the same mechanism can hold true. We're probably going to offer 3 different levels of service depending upon what people need. People that have more medical issues, we may want to track them as we do with the same with the Medicare component, the cohort. So we'll be talking about this more and more. Hit the landing page, give us a call. We'll be able to explain everything to you. And this is going to be a very, very big part of what we're doing going forward, because we're decreasing illness. We're decreasing the progression and damage that you see with aging in so many people. We're preventing people from becoming diabetic. We're reversing hypertension. We're changing the picture so that you're becoming healthier, week to week, month to month with this mechanism. And of course, for those people who need, we do stem cell therapy, which is the greatest reparative mechanism that exists. They're your cells from your body, repairing your joints, repairing organs, etc. We use it for a wide range of different disorders. And the regular website, drcalapai.com, you could take a look at that and see the videos that we have there. So, cool stuff.
Well, we're getting a lot of Happy New Year, Doc.
Yes, wonderful, healthy, and Happy New Year.
First show back.
That's right.
For 2026.
We're here, fresh and ready to march forward. 2026. Yep.
Let's go. We got a question here. How did staystronghealth.com come about? Was there a specific moment that inspired you to build it?
Really good question. So there's a gentleman that I work with in Florida that I've done some medical mechanisms with before, and we've been talking about this for a while. And in my mind, and I've said this to a lot of people, because I've tried to do this without having the equipment, because the equipment wasn't available, 20 years ago. I would try to get patients to put together a weekly diet report, write down what you're eating, breakfast, lunch, dinner, snack. If they're diabetic, check your sugar. First thing in the morning, write that down on the page, fax, email that to us. Let's put it in the chart. So I've been doing some of this without having any of the equipment. And people at home might be checking their pressure every day. I'd say write that down on that same, weekly report so I can see what your blood pressure is doing, because I want more data. Most of what doctors see in the traditional realm is a patient comes in 2 or 3 times a year. They're on meds. You see 2 or 3 blood pressure readings, 2 or 3 sugar readings, etc. A little bit of a weight discussion here or there, but people never get anywhere. It's not enough data. I don't want to see what the blood pressure is doing, day to day, week to week, or the sugar. I want to see how much exercise is being done. I want to see if we need to correct the hormone levels to help to burn sugar, burn fat, lose the weight, which would bring down the blood pressure. So it's much more integrated and evolved. So I've been living in this space for a long while, and then was totally thrilled to find out that both there are companies making FDA-approved and Medicare-approved machines to read your pressure, your blood sugar. There are rings now, and everybody's heard of the rings that you could look at for fitness. There are medical rings. There's a bracelet that a company makes. A few of them make it, but we like one of the companies that makes a bracelet that tracks everything, including your sleep patterns. So we could have all this data gathered, and then from that, fine-tune and maximize and optimize your picture. So very thrilled to find out about the technology, which in part includes a lot of the AI and the latest computerized ability that we have now. Very thrilled that Medicare covers this, covers office visits, telehealth visits, monitoring the devices, putting the devices on, all of that. Always covers your blood work. So it just gives us so much more information and better tools to be able to understand what your body's doing. 3 times a year, what's that? It's nothing. We get blood pressure readings every day, blood sugar readings every day. I'd be thrilled. And patients have a much better connection with their doctor and much better connection as to how to more immediately fix things when those numbers start to go a little wonky on your test. So I think this is just a natural progression for what I've always tried to do. And this just gives us tools that we've never had before. So whether it's the Medicare patients, where we've already begun this, obviously we've done this for a while, and non-Medicare patients who want the same type of monitoring, same type of recommendations, the vitamins, the hormones, the peptides, testosterone replacement for men and women, all of this is under the same big umbrella. And we're going to be sending out information to people. You'll get readouts for your blood pressures, recommendations as to what to eat. It's going to be a super thorough mechanism. So it's been brewing for a while, but now it's coming to fruition.
I got this here. What kind of testing do participants get? Is it blood work, metabolic panels? What's the deal?
Yeah, so our initial big blood test is the biggest blood test that's out there. And recently I was looking at something advertised on social media. Oh, we do 100 tests. Then I sat back and said, 100 tests? That's not a lot. And I looked individually at all the tests that we do. It's well over 200. So each of your vitamins, each of your minerals, your thyroid hormone, which is a 12-panel test, DHEA, DHEA sulfate, adrenal hormone, IGF-1, the active component of growth hormone. We're looking at your blood count. That's another dozen tests. The metabolic panel, which is your chemistries. We're looking at the methylated test to see if you convert B12 or not from regular B12 into methyl B12. We're looking at heavy metals through the blood, heavy metals through the urine. As I say, all of your hormones, estrogen, progesterone, 3 different types of estrogen. So the list kind of goes on and on. All your cardiac risk factors, looking at the secondary cardiac panel, ApoB, ApoA, homocysteine, fibrinogen, all of that. So it's well over 200 things that we're looking at. So that's the start. When we do your consultation, we get that set up. And then depending upon what you have, if it's hypertension, you get a cuff. And as you use the cuff, you press a button, it goes directly to us, and we have your readings. If it's a glucometer, then you're checking your sugar. If it's arrhythmias and you're wearing either the ring or the bracelet, that comes to us. If it's a pulmonary function test or a pulse ox, same thing. There are more devices that are being approved right now, probably month to month, that we're talking about doing. So it'll be a combination of these things so that we can keep track of everything. It's a genius mechanism.
Well,
we're also looking at a company to do genetic testing where one company or 2 of them are in Florida. They would send you the kit, you send it back, you get your genetic testing done, so we have that information. I've been a big fan of 2 types of genetic testing. And years ago, probably 2016, maybe 10 years ago, we were doing the cheek swab test to look at 2 things. One thing would tell us what medications would never work for you, what medications would interact with each other so you can't take them if you have blood pressure and sugar or arthritis. Certain meds you can't take together. Genetically, that would tell us that you would be at risk. would also tell us what medications you would take that you'd have a problem with. So it would never work, problem with, or would work for you, but then also which things you couldn't take together. And for a lot of people that are taking 10 different meds, the doctor doesn't know all of that. So the genetic test gives us guidance on that. So it's a brilliant idea. Years ago, they were very expensive. Now they're not expensive tests. So we want to add that to the picture. There's also the genetic test to look to see if you have cancer risk based upon what's gone on in your family and your genes. It's a great test because if the men in your family have prostate cancer, we have to start testing and following that, early on. So those would be parts of the picture as well.
Do patients get one-on-one consultations, or is it more of a group support?
It's a one-on-one consultation. What I've always done, if I'm doing the consultation, it's me on the phone or me in person. With the volume of what we're doing, we have nurse pracs, PAs, that also will do the conversations with you, set everything up, the blood work, review with me. So it'll be a combination of us. I can't do 500 phone calls a month, but we also are speaking with a big company that has hundreds of nurse pracs, PAs, even doctors if you want, that can do the phone calls with you. Because as this starts to get really big and it gets into the thousands, having this company and a team of trained people doing the exact phone calls the way that I would do them will be done. And at some point, I'll be making the calls. We'll try to figure out how to incorporate that into the schedule. So we'll be able to reach out to and be able to take care of a lot of people.
Let's go. All right, good to go on questions there.
So, yeah, that's our staystronghealth.com. Take a look at that if you like. You can put your information in there. Give us a call. We can set you up, whether you're Medicare or whether you're non-Medicare.
We got someone in the chat that said that they're a nurse prac. How can I get involved? Look at this, huh?
Yeah, you can call the office. Certainly, we'd like to have people that join and help the cause. Just want to see where you're located, because I think what's going to happen is we're going to get people that have relatives in different states, and this is just going to flourish. So we're going to need to have a good number of people on board, doing the calling, and the way that we have it working with the electronic medical record. If we have our nurse practitioner Jackie now, she has an iPad, and she does some of the visits, zips right into our electronic record in the office. So it's in my tablet, my iPad as well. Blood work recommendation is made from a couple of clicks on that device. And if you're not near the office, we send that to you, and you can get your blood work done from our prescription. So I don't think this ever could have been done if I stayed with, your typical chart. I had some charts from patients that, were there when I started 37, 8 years ago. And this is my 40th year as a physician, which is pretty bizarre. Crazy. So hard for me to understand where the 40 years went. But yeah, so all the new advances in technology have made this into an absolute, a possibility that wouldn't have been here before. And things are getting even better, so I'm learning every day.
Interesting question here. What's this crap with the, quote, toss that inhaler in the trash advertisements someone's been seeing? Look at that.
You have to be very careful when you go on social media and other areas, because there are people out there that are trying to grandstand. Oh, toss this in the trash. Never do this anymore, blah, blah, blah. They're hitting a chord in your brain, a neuron maybe, a nerve, to make you listen to the advertisement, think you can toss out a medical recommendation or a treatment to do what they're telling you to do. Do not fall for that. Now, I don't know what your medical concern would be, even if I'm talking to you, and we'll get into that, on a visit, but I would never say, stop this, stop that, because I know nothing about you. And these companies who are telling you to throw this in the trash or don't do this or do that, and they're not medical personnel, they're not examining you, they're not learning about you, they're not doing blood testing, they're not looking at your vitamins, minerals, hormones. they're looking at nothing and making recommendation. That's dangerous. I would never recommend that you do that. It's more danger than there is benefit. So stick with what makes the most sense to you. Have a good exam done. Have the super duper big blood test that we do done. You can get that done in any state. We just have to have a little telehealth visit and then send you a prescription. Get that done anywhere. There are a lot of labs, and actually, BioReference Labs, one of the big labs that we use, LabCorp, we don't like Quest that much because they never get the blood work right. We'll do those blood tests for you anywhere across the country.
We just got some comments. Someone said charting can be improved for sure.
Yeah, so the charting with the electronic medical record now is awesome. So I give credit to Freed AI is a company that does medical transcription. So I looked at a bunch of them. Freed was the easiest to use, and now when I click on a button on my iPad, iPad 10 Pro,
who knows anymore,
whatever the thing is, I can just have a conversation with a patient, discuss everything. It takes all that conversation and puts it into a perfect medical note. So it's a big page of a medical note because it's a big conversation. So we talk about your symptoms, how they may vary, how they start, how they stop, what you're eating, breakfast, lunch, dinner. We go back to your prior page and look at your prior blood test and look at that, and we recommend new blood work to compare and see how the changes are going. So there's a lot of great information in that. You couldn't possibly write that all down. And if you could, you couldn't possibly read it, especially if I was writing it. But that's why the new technology is amazing.
These doctors and their handwriting. Am I right, guys? Am I right?
It's horrible.
This is also just a follow-up from the inhaler and the trash advertisements. How about the warm water before bed? Is that a myth?
I don't think that has much bearing on anything, except for some people it's going to make you wake up to pee.
That's what they're saying, too. That's why we'll wet the bed.
Common sense. Oh, warm water before bed. You see all of these things, and, TikTok and Instagram and blah, 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 have people on there just ranting about stuff that has no bearing to your specific chemistry. So don't, be Dr. Google. Don't be Dr. Social Media. You shouldn't look at those things because they're going to give you either poor recommendations, and whatever recommendation they're giving, it has nothing to do with what your body's doing. They have no idea. And 99% of them aren't doctors. And some of them that are doctors are saying things that they can't say because they know nothing about you. They just want to gather some sort of following or gather some sort of sales. Doesn't make any sense. I was talking to a patient today who's been coming to me for years. I had an office in the city on 53rd between 5th and Madison years ago. I left there in 2002. And they were saying the one thing that I like about what you say, and being thorough and being comprehensive, and of course, the big thorough blood test, you prove to people that their numbers are changing and improving. You prove to people that have low testosterone that when we do the program, you can show them that testosterone is better. They'll feel better, of course, so we need to gather that to put that in the document, the medical record. You'll prove to people that have heavy metal exposure that as we do the intravenous treatment, after 10 treatments, you repeat a urine after the IV, and you could see that those metals are being depleted. So it's all about proving what you're doing and, getting that result. And it makes a great deal of sense. You don't see that really elsewhere. You're just thrown on meds, and they're watching, see, your cholesterol is low, but if you're on a cholesterol med, what about your heart? Do they ever recheck your CoQ10? Do they ever check an echocardiogram to see if your contraction has decreased being on a statin? No. It's risky.
And from YouTube, someone's just saying, aren't statins just nonsense at this point? Isn't there enough information for people to realize that they're killing us?
There is enough information to show side effects and risk. And some of the statins are also correlated with memory loss or dementia. But the realm that makes the recommendation doesn't want you to look at that. They don't want you to go behind their backs and look at statistics or studies or side effects because they want their recommendation to stand. And the weird thing too is that they'll give you another medication. You give you medications galore, and all of a sudden you're on 10 meds, and you're not doing any better. You're not feeling well. I think people have become smart because they're second guessing some of that. And some people just don't want the meds. They want to fix things in a more natural realm, which is what I've been saying for all these years.
All right. Someone's just mentioning, I've seen them on Rumble. They run some of those ads where it's like, it's not a doctor. I know exactly what you're talking about in the chat. And it's always just some nonsense supplement.
And you hear it and see it all over the place. Don't listen to the hype because, people that are in advertising, they understand this because that's their mantra. The advertising that's done is meant to capture your mind in that quick second to make you watch the video. Throw away your inhaler. Wait, I can throw away my inhaler? Don't do this, don't do that, or do this, do that, drink water, So it captures you to listen to a few moments of their comments. Then the next glaring or shocking comment is made, and you stay and you watch and you listen, and then sooner or later, you're getting sort of suggested to buy something from them or to do something, and there's no medical knowledge in between, with you or that person. So it's just sales. It's just selling a product. It's an advertorial, an advertisement. So a lot of people fall for that. I see people that are well-intentioned, health-wise, and they'll see something and say, oh, I bought this because it said I won't need my blood pressure meds. I'm going to be taking, beet juice and this and that. I said, look, whether or not there's any information on beet juice lowering your pressure, which I don't believe there's enough accurate medication to say that everybody that takes this will see that result, because that never happens. Some people don't respond to one blood pressure pill. Some people don't respond to one natural product, a vitamin or otherwise. So you can't just say, oh, stop what you're taking and do this. What if it doesn't work and you have a stroke? You can't do that. So I'd rather people understand that so much of that is hype and may hurt you and may not help you. Don't listen to something where it's just easy fix. There's no easy fix. It takes time to learn about the mechanism, see what the underlying causes are, and then fix that, correct that.
We got this question. Is this true? One of these advertisements I always see mentions something about, quote, insulin resistance. Is that a bullcrap claim?
No, it's a concept, so they take a medical concept that people have heard, and then they guarantee you that it'll change and this one thing will fix everything. That never happens. Insulin resistance, and the easiest way to say it is that your body makes insulin to help to lower your blood sugar when it's high. Are there some people where they make the insulin, or they're making more and more insulin and the receptors are not working well, or the people are overloading that insulin production with so much carb that the insulin can't do its job, or the body and some of the cells become resistant to that effect? Yes. But how do you change that? You cut your carbs down. You increase your exercise to burn sugars and fats. You might use chromium or other nutrients that might help the insulin do its job. You might correct declining hormones that would help you burn sugar and burn fat. And once all of these things are together, you get a great outcome. There's no magic pill that you would have to take all the time to create all of that. And then think of the benefit of doing the exercise every day for a half hour. There's a ton of benefit for that. Your muscles, your brain, your blood vessels, you're flooding oxygen to all your cells, flooding vitamins, minerals, and hormones to all your cells. So there are multiple benefits with what I'm talking about, and probably none with what they're talking about. It's just too much risk. One person with insulin resistance might be totally different than somebody else. There's so many variables.
Back to the Stay Strong.
Yes.
Can you tell us how it addresses heart disease and stroke risk?
Sure. So my first thought is that if you look at an end result, a stroke causing death, a stroke causing paralysis, that just didn't happen that moment. That was evolving over time. You're going to see potentially changes in blood flow, but changes in some of the electrical evaluation or mechanism to understand how your blood vessels are changing or fluctuating. If you're looking at your pulse, if you're looking at oxygen levels, if we're tracking all the risk factors for plaque, and there are 50 of them, we're looking to see how many of those things are in place now, then in the next 5, 7, 10, however many years, maybe 2 years, might increase your risk of having a stroke. So let's just talk about plaque for a minute and blockage stroke as opposed to blood vessel leak, crack, and blood loss stroke, where your brain's not getting all the good things from your blood because blood's leaked out compared to a blockage. So we all know high cholesterol, high triglycerides, low HDL, high LDL, high homocysteine, fibrinogen, high C-reactive protein, inactivity, low thyroid, DHEA, testosterone, because they're also good for sugar and fat burning when they're in the right range, especially with your exercise. Heavy metal exposure binds to the bad LDL cholesterol to become a foam cell, which causes plaque. Viruses contribute to plaque on the blood vessel wall. If there's a bit of plaque on your blood vessel, there we are, and a virus is in your blood flow, starts to come along, it can get stuck to that yellow sticky plaque and just add to more plaque. Calcium can add to it to become calcified plaque, which is hard plaque. So there really are 50 or so things that contribute to that. So let's say you're 50. How many of those risk factors do you have? Your doctor will never test for all of that because they don't think that way. And they're not programmed to understand all of this, to look for it and say, hey, you're at a pretty high risk for stroke because all these things are positive. Some doctors will do an echocardiogram, which is good, tells about the opening and closing of your valves and how well your valves are working. Some doctors might do a carotid test looking for plaque, but there's so many other things you need to look at to get the entire picture. Some might do the calcium scan, the coronary calcium scan, where you're looking at, plaque potentially in your coronaries. These are all good tests, but it's not the full picture. So looking at all of these things would show us your potential increased risk. Then we change them all. So we're taking those risks away. We bring your pressure to normal, taking that risk away. So that's how we do it, because we're learning more about your body.
Shout out to our YouTuber who said, I might need this evaluation after the way I ate during the holidays this year.
Yeah, it's a funny thing because, okay, Thanksgiving is one day, Christmas Eve, Christmas, 3 days, New Year's, 4th day, different holidays. I don't know if people go overboard and crazy, for Hanukkah, as we do for Christmas and New Year's and all that, or office parties and things. But within that couple of month period, people go bonkers. It shouldn't be. And most of my patients, they'll have a little bit of this and that for Thanksgiving. They'll do a little bit of food and maybe go once or twice around the plate, but they don't go crazy. And they work out a lot in between Thanksgiving and Christmas. So if you're working out and your diet's tight in between, then you'll be fine. So that's what we emphasize, the psychological aspect of it. If you're going to go out to a Christmas party, have something to eat before you go to the party so you're full. You're not going to eat much. If they're going to be serving stuff you don't want to eat at the party. But if you go there starving, you're going to eat whatever, cardboard sprinkled with cinnamon and sugar, if you're hungry. But you've got to be able to understand how you can offset some of that overeating, make it easier on yourself.
So someone just said that this one is personal. I have a complication with high blood pressure. It's uncontrollable and nothing seems to keep it constant. The concern, my eyesight is fine some days, but not other days.
Well, there must be a few different things that aren't being addressed that are controlling or allowing your pressure to be that high. Obviously, questions would be, Are you overweight, way beyond where your weight should be? Because that is a very common cause of hypertension. If your magnesium, potassium levels are low on the red blood cell test, which most doctors don't do, that increases your risk for the hypertension. If you have a lot of carbs on board, that's another significant risk. So we have to look at things that traditional medicine's not looking at to help to improve and repair your body. There are many people that when your body is sort of set on this downslide, it's not repairing itself well. It could be because of low NAD, nicotine adenine dinucleotide, or IGF-1, your active component of growth hormone, which helps you to burn fat. It's good for your hair, skin, nails, memory, focus, energy, endurance, sexual drive and function, etc. So there are a lot of things that traditional approach doesn't look at. They're just throwing meds at you to see, guessing whether they'll work or not. So you have to kind of go back to drawing board, look at all of those parameters and fix each one. And then for some people that are all haywire, using your own cells to shut down the inflammatory cascade, stem cell therapy, would be ideal to help to improve your repair. It's the ultimate repair mechanism. Nothing does that. You're putting new cells into all of your tissues that have wear and tear and damage.
And then just a follow-up from that person. They said, I will walk around with crap vision, can't even start to try to read without glasses. Does that make you wonder in a certain direction to what my issue is?
Well, if your vision's fluctuating.
And then just a follow-up as well. They said, I could probably stand to lose 40 pounds working on the weight thing.
Okay. If your vision is fluctuating, it's not as though your lens in your eye that allows the beam of light to be focused to your retina is changing, getting better and getting worse. It's usually a non-changeable mechanism. It can get worse if you're diabetic, if your sugars are high. So it's not as though your eye is changing back and forth. It could be the blood pressure creating an issue where you're not getting enough blood flow to your eyes, so your vision's not good. It could be tiny little particles of clots that could form that may be hitting and then dissolving. I've seen that happen before. So there are reasons for your vision changing, but I certainly would want to look at all of those things I mentioned, and then in whatever way we can get you to lose the weight, because bringing down 40 pounds or so would definitely bring your blood pressure down. I don't know what your weight is, but...
Well, they just answered that.
Okay.
That's funny. You're good, Macross 2012. They said, work on the weight thing, but at 6'4", 250 pounds, I am not really grossly overweight. You're a tank. I'm 6'2".
Okay,
That's
so,
looking up.
You know, I was going to say you got a good, healthy
stature.
Weight on board, stature, but I'd rather have it where you burn down 40 pounds of fat and put on 10, 15 pounds of muscle. Or you burn 50 pounds of fat and put on 10, 15 pounds of muscle. Because then you would look at that 40 pounds, let's say take 15 away from 40. You've lost 25 pounds of fat, but you've made your body more strong, more viable. You'd have more endurance from exercise. And the more exercise you do, the more you're training your blood vessels to open to receive the blood flow from the exercise, so it decreases your pressure. So, yeah, I see this all day long. Not difficult to do. It's just learning your specific need, your requirement, and the different things we have to change to get your blood pressure to come down. But in so many cases, physicians don't know that much more than the patient. I've spoken to patients, I had 2 this past week, that said, my doctor said there's no way to bring my pressure down, and I'm on a bunch of meds. I'm like, but your weight, didn't they talk to you about bringing your weight down because it'll bring your pressure down? No, they said it has nothing to do with it. That's wrong. So I hear crazy things all the time. A patient today who's menopausal, low estrogen, progesterone, testosterone, DHEA, et cetera, low IGF-1, had a full conversation about the hormones. She said, well, my GYN doesn't want me on hormones. I said, why? I said, DHEA is adrenal hormone. It's a vitamin. It's simple. It can convert to a little bit of testosterone, maybe get your levels to come up a little bit, you'd feel better. Maybe a little bit of estrogen, progesterone, your estrogen, progesterone, not an outside source, but taking DHEA can do that. That's the way we start in lots of women. And that may be all you need for a bunch of years. And she said, no, if I take any of the female hormones, estrogen, progesterone, it's going to take plaque and put it in my heart. I'm like, what? It's going to migrate the plaque. I'm like, what do you mean migrate plaque? Move plaque. She was saying things, I'm like, I don't understand. Migrate or move plaque to your coronaries. It doesn't do that.
Going to give it a plane
There's
ticket?
there's no mechanism for that. I said, your body, as you lose your hormones, becomes more and more unhealthy. All I'm saying is that if we bring them back a little bit, not to where you had when you were a teenager, but you bring them back to where you were 10 years ago or so, and we're tracking it, and you see your benefits, and we use the natural mechanisms to lower cholesterol. We look at the 50 plaque risk factors, and we negate them. There's no chance of that being a problem. 10 or 15 years ago, you had better levels of the estrogen, progesterone. Why wouldn't that rush the plaque to your coronary? They say things that just have no scientific background behind it. And I guess they just think people are not going to look it up online. So when the patient looked it up online, she couldn't find anything about it. And she thought it was weird. I'm like, well, yeah, that's weird. For sure.
Is there something you mentioned before about smoking? So a bunch of people said, stop smoking, don't smoke. But I don't know.
Well, cigarette smoke. I mean, there are 4,000 chemicals in the processing of cigarettes, and it's all bad all the time. There's no benefit to it. Smoking has been linked to a lot of different cancers, obviously, damage, plaque in your blood vessels. It's all bad all the time. No benefit to it.
Got this one. There's a big highlight story slash advertisement now on ABC News that talks about stem cell banks. There's an editorial streaming. They also call it bone marrow matching. You can donate to someone across the globe.
I think for years they've had these big, super expensive facilities that will take an umbilical cord and freeze it and save it, typically used for that child if they had some medical problems like a cancer down the road. Right now, there's no mechanism for anybody other than the child to be able to use that umbilical cord other than that child. Are there companies that are going to try to create stem cell banks, as they are, so that people can try to match and use those? Possibly, but it's still not from your body. And the companies that make these stem cell banks where they keep the frozen umbilical cords are making gazillions of dollars in doing that. I met a guy in Europe once in Saint-Tropez, just randomly at a restaurant, sitting next to me with his girlfriend. I'm with a group of friends. And he sold a stem cell business, that was keeping everything frozen, et cetera, for like $8 billion.
Oh, my goodness.
I said, wow. Good for him, of course. But business will always find a way to sort of capture whatever they can capture. Why wouldn't you just use your own stem cells? Because that's the best source you could ever get. No risk, no downside, no side effect, all benefit. So there's always, a company out there trying to do something that is not going to be as good as what you could do with your own cells.
And just back to our 6'4". Listen, I'm never picking a fight with you, sir. He just said, I'm already on 4 meds, just been put on a 5th in the last 2 weeks, and I'm not understanding it. It feels like we're on the wrong path.
So the first thing I'm going to say is going to be a universal truth. But, through my life every day, I say lots of universal truths. But this universal truth is that your doctor is giving you a medication and guessing as to whether it's going to work or not. He doesn't know if it's going to work. Oh, let's try this. They'll say that. Let's try this. It may be a beta blocker, calcium channel blocker, ACE inhibitor, diuretic. It's always a guess with a drug. Always. It's a guess at what drug for the infection you have in your sinus, your toe, your gut. Yes, if you have a sore throat and a doctor is a good old school doctor, he swabs your throat and he finds that you have a specific bug. And when they do that swab, they grow the bug and culture it. And then they test to see what antibiotic will kill that bug the best, which is the old school way of doing things, which is great. Then he'll know that that drug will work because they've used an antibiotic-soaked disc on that growing bug in culture, proving it's got a good kill zone. So that's proof that a drug will work. Every other drug, it's a guess. So now you're on 4 going on 5 guesses and not getting the result. Well, my question is, if the first one didn't work, why is it still there? If the second drug didn't work, why is it still there? Third, fourth. Why do you have to be on 4 drugs that aren't working and then go to a 5th? Doesn't that not make sense? So
You should call the office.
they're missing the entire picture of learning about your body. They're not. And it's just guessing at what medication to throw at you. Where's the knowledge there? Compared to what I said before. Do your super duper blood test, low carb diet, lots of exercise every day, fix things. And where you understand why I'm saying or doing these things, nobody leaves my office saying, I don't understand what he said, because I explain things just as I do here. So you'd know why we're doing this, why we're doing that, what to look for, what to expect, and how to get your results. And if you're on Medicare, then you obviously qualify for the whole Stay Strong longevity mechanism with the devices like the blood pressure cuff or maybe the bracelet. I think maybe I should call it something different than a bracelet, because a bracelet doesn't sound manly. Not for a guy who's 6'4" and 250 pounds. Would you like a bracelet or maybe an earring? I'm sure they're going to make earrings at some point, but it's a wristband, a manly wristband. But yeah, certainly give us a call. This makes ultimate sense to help you. And whether you're near or far, either way, we can do it, telehealth visits, etc. But 516-794-0404. But, the discussion is great because it allows me a little bit of a platform to say this is how we should really learn everything about your body and fix the entire picture.
Someone said, I'm glad you include the Medicare folks.
Yeah.
And this is a side question. Can even calcium or iron minerals, being heavy metals, create plaque?
Calcium can add to plaque. So for many years, researchers were looking to understand what's in plaque and why it's there. And that's why I mentioned the 50 things, because I looked at all these different studies. So veterinary researchers, one of the first, probably 50 years ago, when dogs had issues with blood vessels or plaque in animals, and they were cutting away the plaque, and they found that viruses were the first part of the inflammation on the lining of the blood vessel. If you cut away the plaque and you saw what was there at the base, they found viral infection, and that led to a massive study of viruses inflaming the blood vessel and then plaque built up on top of that inflammation. Then, of course, cholesterol is a villain for a long time, even though homocysteine elevation is probably as bad or maybe worse than cholesterol. There are people all over the world with high cholesterol and no plaque whatsoever, especially in Italy. All that good food, all that happiness, the good music, the dancing. So there are a lot of things that can contribute to that. But again, we have to look at all of those things that may be there to do that. So it's a lot more than just, using meds.
Okay, got a few. Chat, by the way. Happy New Year. This is great. Great
Happy
turnout.
New Year.
What do we got here? Would you also test for essential minerals?
Always. Vitamins and minerals it's part of the initial blood test. And so to give people an overview, the person that comes in whenever this week, I sit down, examine them, take their history, discuss everything. click off on the computer all the different blood tests to do. We get that set. And that comes back in 5 days. Within a week, we sit down, go over the blood work, make recommendations, diet, exercise, vitamins, minerals, hormones, NAD, Somorlin, whatever we're recommending, sometimes vitamin IVs, chelation to pull metals, and the process begins. And then within a few weeks, as the patients come back 3 or 4 weeks later, once they've started the protocol, they have to give me a list of the things they see improving, their weight coming down, memory focus better, whatever. Then we recheck the blood to prove that the recommendations we made are improving your hormones, testosterone, DHEA, thyroid, IGF-1, your physical benefits that you're explaining and what the blood tests show. And we know that we're hitting the nail on the head. So that's what we do. And then maybe within a month or two after that, we might recheck, because if we're waiting for your cholesterol to come down, if it comes down 20, 30, 40 points within the first couple of weeks, great. If we get you to normal, then perfect. If not, then the next month we revisit that and see what we need to change and tweak up the exercise some more, tweak down the carbs some more, etc. So we're really learning about how to continue to get your result by fine-tuning your picture. So we may do the vitamin blood test 3 or 4 times a year.
Do you do anything with ozone therapy?
We do peroxide, which is, H2O2. Ozone, I think, is a little bit harsh, O3. Some people get inflammation in their blood vessels when they do an ozone IV. And I haven't seen, and I've done this forever, any significant benefit of the ozone over the peroxide. There are people who will get prolozone shots, an injection into their knee with ozone gas from an ozone generator put into a syringe, and you're pushing ozone into the joint. And people say, oh, I feel great. I say, you think you grew a torn meniscus with an injection of ozone in a day? It's just not possible. And then they feel worse again. So, yeah, someone can stick lidocaine into your knee and you'd feel better or great, but it's not doing anything. So you don't want that cheap, quick relief of symptom without the repair occurring with that. That's why we typically do PRP or stem cell therapy for the joint. So it depends upon what your body needs. That's what dictates the recommendations in the protocol.
All right, what else we got? Would you treat these plaques different? I think that was from before with when you were talking about calcium. Would you treat these plaques differently?
Well, the calcium EDTA is a thing that we use to help to decrease the heavy metal burden, and there is evidence over many years that may help to decrease plaque. But you have to hit all of those 50 or so things, however many of them are there, to be able to make a change in what's happening going forward. If you don't change that, it'll just keep happening. So in a slightly easier way to say it, if you're using aluminum in your deodorant every day and you're putting aluminum into your armpit, which heats up, your blood vessels dilate, and you're bringing that aluminum on board, that's bad. You've got to stop the aluminum deodorant, switch to one that has no aluminum. And you're decreasing your intake. Get rid of the pots and pans that are aluminum. Get rid of the aluminum foil. And if we're removing the aluminum and the metals with the IV protocol, then you're changing that picture. But if you still have the foil, the pots and pans, and the deodorant with aluminum, kind of spinning your wheels a little bit.
Yeah, tinfoil's a big one, huh? I never thought of that.
Well, we see people that have crazy blood and urine levels for aluminum in mostly the summer and the fall because of all the barbecues. And people are wrapping the corn and the food in the aluminum. And
oh, wow.
I remember going to someone's house and they had a big party and they had big seafood salad. And I had some of it. It was great. And then they were wrapping it up and putting aluminum over the seafood salad. I'm like, And I told the person, I said, and they didn't believe me until they saw it. The aluminum is really not good, especially when it is in contact with, vinegar and some other components. I said, wait till you see what that aluminum foil looks like tomorrow or the next day. And you could see where the aluminum foil was just breaking down.
Wow.
And then if you leave it in there long enough, you're going to see little holes in the aluminum foil because of that chemical reaction. Don't use any of that. Aluminum is a major contributor to Alzheimer's.
Wow. That's terrifying. I'm throwing
And
it
one of
all
my
out.
patients that I had this conversation, he says, yeah, you know, people are stupid enough. They don't need the aluminum on top of that. And I'm like, it was like a Rodney Dangerfield comment. I'm like, well, you know, you're right. Yeah, they're dumb enough. They don't need anything on top of that.
That was good.
Yeah, I tell you, I get no respect. I got a lot of aluminum, but I got no respect.
Oh, man. This stem cell patch stuff, hype or possible benefits?
Hype.
I've never even heard of that patch.
People are sold on creams that you put on your face that have, oh, plant stem cell, blah, 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 doctor this, doctor that. It's all brilliant advertising to get people to spend a ton of money on something that has very little chance of working. Unless they're the cells from your body extracted and then put right back in, you're not getting anything. There were some doctors years back, I remember seeing a couple of studies where doctors were trying to use a, quote, scaffold tissue. And it was meant to cover damaged skin and wounds and be absorbed into your tissue. The idea is great, and I think they're still using it. And then some doctors said, hey, if you're putting that there for a little bit of a structure, why don't we add PRP or stem cells from your body to that, which made a great deal of sense, which created great healing. I've treated patients that have had, you know, leg ulcers that are diabetic, heel ulcers, some back ulcers from laying in, you know, hospital beds and such. And we did stem cell IV going to all their blood flow to their skin as well and injected around the ulcer, and the ulcer heals super fast. So there's no patch per se, but if you're using your own stem cells, and the companies that deal with, you know, foot ulcers use these hyaluronic patches, then that would be an advantage to use those together.
Just got a comment here. Use wax paper instead of tin foil. Smart.
Absolutely.
Are we gonna learn something about wax paper then next?
I don't know.
Better than metals.
Better look at wax paper now before we make the recommendation.
Another comment. Yes, I could see how the tomatoes sauce would clean my mom's pans when they put the pot in the fridge overnight.
Yeah.
My Italian mom was a great cook, though.
All that good Italian food. Can't beat it. I love good, healthy food. I mean, who doesn't? Me, maybe more so because I was brought up with so much of it. But, you know, and now when I think of ordering food, I talk about Moolah Farms. I want pure food with no crap in it. Who wouldn't? I want the organic, you know, free-range type of chicken and the organic eggs and the milk and all this stuff that's got nothing in it. And when you taste it, you're just like, wow, what the hell was I eating before that tasted like cardboard that now this tastes great? So I'm super happy and thankful that there are a few places around me, including Moolah Farms, I talk about them all the time, that have the great eggs and the chicken and the natural butters and the honey and, you know, the list goes on. And the steak, they have every cut of steak, all sorts of great things. But the flavor is there. It's just not some gray chemical meat that you're getting or who knows where from, where you've got no flavor and, you know, a lot of bad stuff.
Yeah, and it's amazing because me and you were talking off air and we're looking up the price of like a gallon of milk from the grocery store, which is, you know, dyed and not very nutritious.
And hormones and hormones and hormones and who knows what.
Right.
You know, and they're more expensive than some of the things you can get that are natural.
Right. What?
I tell to people very directly and all my patients, if you live near an organic farm, go buy things there. Get all your food there. All your vegetables, you know, your meats, your poultry, your turkey, your chicken, your steak, etc. Go to a place where it's farm raised and grown. There's another place out on Long Island. I'm not sure the exact town, but it's called Accabonac Farms. And maybe that's the name of the town.
I was going to say.
I don't know 100%.
I'd guess.
But it sounds like an Indian name that could be a town. And they have a lot of meat. And it's a big, organic, natural facility. I don't know what their prices are because I haven't compared them yet to what you would get otherwise, but you're getting pure, fresh stuff. There's Molosky's Poultry Farm on 25. I think if you go to exit 64 on the LIE out towards Brookhaven, it's right past East Wind Spa, which is a spa and a wedding venue, et cetera, or a convention place. And they've got duck eggs, natural duck eggs. They've got free-range chicken. They have all sorts of stuff out there. Another good place to source from. But there are a bunch of spots to get things from that are not crazy expensive. Whole Foods might be a little bit more expensive for some of these things, but find your local farms. They're all over New Jersey. They're all over Connecticut, Long Island. If you're near Huntington, there's a farmer's market every Sunday. If you're near Eisenhower Park on Saturday, Long Beach Wednesdays, and Moolah Farms goes there with tons of other places to bring the good food there. That's where I would shop. Luckily, they're 5 minutes from where I live, so I zip over there all the time.
Someone just said, I raise chickens for myself. Doesn't save you any money, but when you see the yolk difference.
Oh, yeah. Years ago when I first started going to Europe, I guess in the 90s, I would go to eat at a restaurant or a little bed and breakfast place that I would stay at or wherever I went, and they'd bring out these eggs, and I love sunny side up eggs, over medium. I have to have a little bit of looseness in the yolk.
Yeah, I'm with you.
But I like the white has to be tight. It can't be gooey. And I look at the color of these yolks. I'm like, what the heck is that?
It's like orange.
Yeah. Why are these yolks so orange? And why do these eggs have so much flavor? And they're a little, I don't know if the right word is creamy, but they taste so much better. When you go back home, you're like, ugh, it's like cardboard. Then I started to realize it's a whole different thing, a whole different world. But now you can get this from these places. I told you my Stephen King, I want to have a Stephen King write a book about chickens. I went to one place in Minnetonka. It could be the beginning of a great horror movie. There's a place in Minnetonka. It took me forever to find. It's just a simple name. Of course, I forget the name. I was there like 2 months ago. Someone told me to go there. My friend Ray, who owns Estate Dry Cleaners, by the way, best dry cleaners in the world. Estate Dry Cleaners, in right across Northern Boulevard on 106 Glen Cove Road. A little plug for Ray. So I drive to this place. I get out of the car on this long, winding road, and I'm looking around. There's all these chickens running around, every color, chicken, size, all this stuff. I got out of my truck, and I'm going to walk over to the fridge where you can get the eggs. And I'm looking, and the chicken are all looking at me. Thousands of chicken, like in the Planet of the Apes. And I'm Charlton Heston, and all the apes are looking at Charlton Heston. It was just, they're all looking at me. I look around, I'm surrounded by chickens that are looking at me. I said, they're probably just friendly chickens. I said to myself, well, chickens aren't dangerous unless there's 1,000 trying to attack you all at once. But no, they were looking at me. They watched everything that I did. I got some of the eggs and stuff, put some money in there, a little extra tip. I got back in the car, and I forgot to close my door. And now they're a chicken that I have to wade through to get to my door because they were thinking of trying to get into my car and escape, I think. But it was pretty wild, to see chicken everywhere just looking at you. And they were walking all over the place. It took me like 10 minutes to leave the place because they were all standing in front of my car. And I'm inching my way, trying to get to the, gate to get out. And they were just blocking me from getting out.
It's like, what's that?
Very interesting.
That Alfred Hitchcock movie?
Yep.
The Birds? Is that what it's called?
Yeah, The Birds.
I was so lucky as a kid because one of my best friends, their family raised chickens, but they didn't, they weren't big egg people. They just wanted the chickens to have chickens. So they would just come to my house with just dozens. Wow. Oh, it was incredible. I
think there's a farm in East Hampton. It's still there, but I used to go out there a lot. If you go into the middle of the town of East Hampton, and London Jewelers is on the right, there's a street you can make a left on before you leave the town. You go a little bit, you make a right, you go over the railroad tracks, and there's Iacono Poultry Farm. You can go get the eggs, but you can get fresh killed chicken. Free range, organic, healthy. If you want, you could go and pick out your chicken, I think. Then they go and they grab it. If you want to watch them do the procedure, you could. I did because I'm curious. I didn't pick out the chicken, but they ran out, grabbed it. They took it, broke its neck, put it in an upside-down funnel, cut the neck, drained it. I said, wow, that's how they do it?
I like it dead and deep fried.
Yeah. And then they put it into a thing that took all the fez off. And then in like a nice wax paper, they hand you the chicken. You know, it could have it, quarter, whatever. And it's really super warm. You're like, damn, that's a warm, dead body. And it was as fresh and as immediate as you could get it. I'm sure they're doing thousands of chickens a day. It was a big, big business back then. And people came from all over the place to go to this farm. I'd like to see if it's still out there. I'd like to think it is because they were very nice people.
Someone in the chat said, if you want to raise chickens, they are relatively self-reliant animals, and hens aren't that noisy. Keeping them in the yard during the day can get complicated until roasting time. See, here's my problem. If I raise chickens, I'm going to, I'm going to end up naming them. I'm going to have a little relationship. I don't know if I could do it, Doc. I don't know if I could. I'm going to be best friends with these things.
Yeah, that's the hard part.
But kudos to you.
Wow, Iacono Farm.
Still up?
Hot damn, yep. East Hampton. How long has it been there? Got great reviews. 100 Long Lane, East Hampton.
May have to pay them a visit.
And they're still cranking it out. It's family owned, operated since the early 1900s. God bless them. That's a good thing. Gotta love that. My mother's side, my mother's grandmother had like 18 kids, and I think 4 of them died young, but all those kids had like 10 kids. So the grandmother had an Italian store in Brooklyn called D'Amato's, and everybody in the neighborhood, in every neighborhood, used to go there. But, half the neighborhood was my mother's side of the family. And all the kids worked in the store and blah, blah, blah. And how cool would that have been to have, your whole family working one business? Especially that many people. But that's what they did. They had a lot of kids, because it was cheap labor.
Right.
But all your food was made and then homemade pasta and everything you made. I mean, that was genius. That's how people survived back then.
And now people can't afford to have 2 children.
Exactly.
That's great.
The average is what, 2.5 children?
Something like that, yeah. And going down.
I just don't get that half. What do they do with the other half? Let's talk about some of the cool articles. I don't want to forget that today. This is a study talking about dancing, reading, and video games could help to delay brain aging. The problem that I see with this is that it'd be very hard to do all 3 at once. You may have to do them separately. So creative brain activities can delay aging by 5 to 7 years. Music, crafts, dancing, reading, gardening, thank you very much, and even playing video games. I'm still looking at the list. I don't know about cleaning the house. That might be taking out the garbage. It might be good for your brain, because I know a lot of people will complain about their spouses. Specific to that, dancing, drawing, things that are cognitively demanding, emotionally engaging. So, pretty interesting. And if you look at people that live a long life, they've always got something going on. They never sit around and do nothing. They always have something to stimulate their brain and to help to keep things moving and going. Do high-fat cheese and cream help to keep the brain healthy? Now, this would be counterintuitive if you think about what the traditional realm has been saying for years. They said fat is bad forever, but I don't think we should believe these people. You probably never should have believed them in the first place, because a lot of things that they said were good are bad. A lot of things they said were bad are good. A large new study, and this comes from Medical World News and fact-checked by a couple different doctors Salati Shulman, PhD. Let's see where this was done. Published in Neurology, a prestigious journal that's been around forever. High-fat cheese like cheddar, which I like very much. Extra sharp, thank you. Brie, which I like very much. Or Gouda, which I like very much. And cream, lowering the risk of developing dementia. Your brain's made of fat. It needs good fats. People who consume 20 grams or more of high-fat cheese daily had a 13% lower risk of developing dementia. Thank God for charcuterie boards. I love a good charcuterie board.
Best friend.
People who consumed 50 grams or more of high-fat cream had a 16% lower risk of developing dementia. Pretty cool.
Wow.
Big study, big, impressive journal from the American Academy of Neurology. High-fat cheeses are those contain more than 20% fat. Cheddar, brie, Gouda. High-fat creams, more than 30-40% of fat.
This isn't good for me to hear, Doc. This is going to give me an excuse.
Well, I don't want you to lose your mind as you get older.
Bring on the charcuterie.
Charcuterie it is. In our early work in the same Swedish cohort. Consort means something totally different. Although a Swedish consort might help prevent dementia. Hey, you've got a beautiful Swedish woman with cheese. I'm in. I think, Frankie, we need a road trip. In this Swedish cohort, we found that cheese was linked to lower risk of cardiovascular disease. Large international studies, including those from the U.S., have documented that. So the researchers in the Swedish cohort, maybe consort study, 27,670 people. Participants had an average age of 58 years. They were followed for 25 years. And those individuals who had the most significant amounts of those fats, as we mentioned, had a pretty dramatic decrease risk in dementia. 50 grams of cheese, it's not even a lot. I go way past that, is 2 slices of cheddar. Who can have 2 slices of cheddar?
Not me.
Got to be at least a few slices.
It's at least half the block.
5, 7, 10, especially if you're having it with some grapes or something. A typical serving is about an ounce. Pretty cool. And now let's talk about coffee. Anybody out there like coffee? So we've blown the lid off of the people who say fat is bad for you without looking at anything else, because fat is not bad for you. And now we will look at coffee. Some people think that coffee might be bad for you. Recent studies have highlighted the health benefits of coffee, particularly its influence on longevity and reducing chronic disease risk. A study suggests that consuming 3 to 4 cups a day of coffee could increase lifespan and may add 5 extra years to your life. A recent review indicates that 3 to 5 cups a day could decrease mortality and lower the risk of some diseases. Third body of research points towards the health benefits of drinking coffee, especially in women as they get older. Coffee is one of the most popular beverages in the world. More than 2 billion cups of coffee consumed daily worldwide. And the average person has 3 cups a day.
Oh, it's good to know I'm in the average. I thought that was a little above.
Major psychiatric disorders, such as depression, bipolar, and schizophrenia, have accelerated biological aging. A study in the British medical journal Mental Health publication in November 25 indicates that consuming 3 to 4 cups of coffee a day could slow premature aging in individuals living with major psychiatric disorders. On one hand, you might think that people that have psychiatric disorders, you don't want to wind them up and give them a lot of coffee, so they're... But this is a big study. The study found that individuals around age 65 with major psychiatric disorders who drank 3 or 4 cups of coffee a day had longer telomeres. Telomeres are the ends of the DNA sequences on your chromosomes. And when telomere length shortens with age, it's a bad thing. Your cells get older and break down and die sooner. But if they're keeping your telomeres longer, that's a significant, reproducible protection for age-related change. They say they typically see that people within this realm, the telomere length, they have 5 to 7 years, or they're younger biologically.
Someone's asking, he said, I thought stimulants are bad for you in general.
Well, I guess it depends upon the stimulant. If they can prove, as they have, that coffee helps your telomeres stay longer, then that's pretty significant. That's not something you could miss. Other things that may be stimulants that are not increasing the length of your telomeres would not be good. 3 to 5 cups of coffee a day may increase longevity, decrease diabetes risk. In a review published in the journal called Nutrients, August 2025, lower risk of cardiovascular disease, type 2 diabetes, certain cancers, cognitive decline, respiratory illness with coffee consumption. The authors think that the polyphenols in the coffee help with glucose metabolism, reduce chronic inflammation, reduce oxidative stress. Nutrition 2025 conference, the Nurses' Health Study, which is a massive nurses' health study in women, 47,513 women tracked over decades. The authors defined healthy aging as reaching later in life with no major chronic diseases, no physical impairment, no cognitive or memory issues, intact mental health, no functional limitations. The author of the study, Sarah Madhavi, and she's got more abbreviations after the name than the average person, who is a postdoctoral fellow at Harvard T.H. Chan School of Public Health, was the one that described this. So pretty interesting. So some of the things we've been told for many, many years may not have been true when we were told them for many, many years. Let's talk about one other thing.
I'm scared.
Let's talk about 2 things. Every year in September, we're told to get a shot, a flu shot. Okay? Everybody knows this. How is it that it's September of every year that this new bug seems to pop up? Why September? Just curious. Just asking for a friend. How long does it take to make 300 and some odd million flu shots for all the people of the country if they were willing to take it? Not a month. So if it takes 3 years to make 350 million vials once it's tested, et cetera, how'd they know 3 years ago what bug was going to be here 3 years later? And you hear all the time, oh, the shot didn't cover the strain of flu that was here. Well, then it's worthless. Interesting.
Quite.
I have a bigger comment to make. You like this. So this bug comes around out of a country called China.
China.
I still laugh whenever I see that video. And that bug just came upon us, and within a few months, it's wreaking havoc all over the world, blah, blah, blah. All of a sudden, there's a vaccine for it. How is that possible? And how many people do you think were vaccinated over a couple of years against that bug? Billions. Right? Were there 8 billion people in the world? Give or take a few. I know they're having tons of people every day in China, people every day in India, people every day in some of these places that have the biggest populations, whatever. How many people were vaccinated with the first round of those vaccines? Billions. How long does it take to make billions of shots? Not a month, not 2 months, not 3 months, not 6 months, not a year, not 5 years. How many facilities would you have to have working full time to be able to make that many little individual bottles of shots? Purified, tested, retested. Think about it. Seems like something funny's going on.
I'd say. Someone mentioned this in the chat, and I'm just Googling it, but late 2025, an internal memo by a top U.S. Food and Drug Administration official claimed that an internal review found at least 10 children died after and because of receiving the COVID-19 vaccine during trials.
Yeah.
Sounds like something you should roll out.
They're not telling you about it. The other thing that I have a problem with all these injections, including the pediatric schedule, is in medicine and surgery, in any realm, when a doctor's making a recommendation for something, there has to be complete, informed consent. You have to say, I'm doing this procedure. These are the risks, the alternatives, the benefits, side effects, problems. If you're getting injections, what's in the injection, right? You wouldn't just take an injection for rheumatoid arthritis unless you knew about the drug. You could research it. You have to be told what the drug is. They'll give you an insert. How many parents were given a list of all the ingredients of the childhood injections? None. Ever. And how many of those childhood injections were rigorously studied or tested for safety? None. No informed consent. Why in 1986 were the manufacturers of those injectables made non-liable for bad side effects to those injectables? Because politicians gave them that protection because they were obviously paid to do so. I had read one of these things online where someone said, how long would it take to make 6 billion doses of an injectable? So if it's 10 years, and how many facilities would you need to be cranking out these things like crazy over that period of time without anybody knowing what was going on? There was no informed consent. They're using a totally different type of injectable, which was never used before, which obviously now we know is contributing to autoimmune disease, myocarditis, death, blah, 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 increased cancer risk because of the P53 gene that's being inhibited by the injectable. Think about it.
Yeah. Someone said, so much for informed consent. What a healthcare violation that was.
Super. That's why I fully believe that the people that made all of these things are completely responsible and liable because people were not given any guide as to or given any choice. Strange but true.
Heinous.
Let's see where we're at.
Where we at?
Pretty good. An hour and a half?
Yeah, hour and a half.
We've got 2 minutes. Got to find something brilliant to say for 2 minutes.
It's just so funny. Someone said, when you were talking about the coffee, they said, I'm not a fan of coffee. Too bitter to me. Sounds like I'm going to have to get over it. Can I add a shot of vodka?
Not a bad idea. I've known people, and I have patients that live to a very old age, and they swear that it's because they've had a shot of something, whiskey or vodka or cognac or whatever they take a shot of every day. And it's a big European thing. I mean, look at all the European people that drink a lot of wine or shots of vodka. And I know a lot of people that come from Russia that are all about that. And the grandmother, she took a shot of vodka every night, helped her sleep.
Of course they're Russian.
Yeah, it probably killed all the bugs that, were potentially there to create problems for him.
More vodka.
Vodka. Yeah, so you have to look at some of the things that people have done to make themselves healthy. There's a lot to be said for that. I know a lot of people that take, as I do, a tablespoon of olive oil every day. Sometimes they'll take it at night, sometimes take it in the morning. It's good for you. Helps to kill germs in your gut. There's even evidence that helps to kill Helicobacter, which is a bad infection, bad bacteria. So there are a lot of natural things that I think make sense to do. Awesomeness. StayStrongHealth.com.
Just
Yeah,
saying.
good show. A lot of good stuff.
Great start to the new year.
Hit the website. By next week, we will have a QR code, so you can click on the QR code, go right to the Stay Strong landing page. We're going to have a bunch of landing pages for STEM, for all the different things that we do. Ramping up with all sorts of new information we can put together for both Medicare and non-Medicare patients who like the idea of Stay Strong, wellness and longevity. The vitamin pack, which is working brilliantly for us and for our patients to really maximize and minimize, taking too many pills that are just not there doing anything, or things that would never work for you because there's some bizarre idea. So to maximize your benefit from taking vitamins based on the blood test, the recommendation, as I've done for all these years, retest the vitamin levels to prove the results are great. The blood test is perfect. All of this, part of a comprehensive mechanism. So that's something that we talk about and I've done for my entire career. Give us a call at the Garden City office, 516-794-0404. We can do telehealth visits as well. The website, drcalapai.com. And staystrong.com.
Let's go.
Cool stuff.
Oh, yeah.
All righty. Thank you for listening. God bless you all. Have an amazing weekend. Happy New Year. Let's make the new year count. Let's become strong, healthy, driven, and make ourselves enjoy the beauty of what life has to offer when you're super healthy and super fit.